Namaste, I am Dr.S.Jayaraman. I am a consultant pulmonologist. I am the Secretary of Indian Medical Association, Academy of Medical Specialties, IMA AMS Tamil Nadu chapter. May 31st, every year, as per the WHO recommendations, we do the awareness program to commemorate World No Tobacco Day. World No Tobacco Day is an important day for all of us because smoking causes lot of diseases from head to foot. In the tobacco smoke, there are more than 4,000 chemicals are present in that tobacco leaf. During the burning, the smoke contains lot of chemicals, more than 4,000 chemicals as per the scientists report. In that 4,000 chemicals, there are more than 250 chemicals are carcinogens, that is cancer producing substances. So, because of these chemicals, bad chemicals and carcinogens will cause lot of diseases, mainly the cancer and the lung diseases, mainly the COPD, chronic obstructive pulmonary disease, pneumonias and worsening of all the diseases. There are three kinds of smoking you all know very well. One is the active smoking. If a person is smoked directly, inhale the smoke, it causes active smoking. If the person is having we call it as a passive smoking means, so neighborhood, other persons, while we inhale, active persons exhale that smoke, which leads to inhalation of the smoke by the second person. There is a non-smoker person, we call it as a passive smoking. Another one is the third hand smoke, otherwise called as the, this is important. Suppose third hand smoke is nothing but, if I am smoking, so I will go out. So other person, non-smoker person will come inside and sit for a few hours or few minutes. So a lot of smoking particles circulating in the air. That air will go into the lung during inhalation to the non-smoking individual persons. That is called the third hand smoke. So we have a first hand smoke or active smoking, second hand smoke or passive smoking, and third hand smoke. So any form of smoking is very bad. Other one is the electronic cigarettes or vaping. This is also same as smoking, that is cigarette and BD smoking. If you take the cigarette and BD, which is the more potent substances, more bad. So BD has more carcinogens, more chemicals, more irritants, more harmful than cigarette. Because in the cigarette we have some filter. In the filter cigarettes, some of the chemicals, 10 to 15% it will reduce and it will inhale. Because in a BD, without any filter, directly goes into the lung, it causes more damage. So in India, BD smoking individuals are more when compared to the cigarette smoking individuals. So BD is more harmful than the cigarettes as per the study. So any form of tobacco is injurious. So in our country, we see a lot of chewing tobaccos. Chewing tobaccos is one of the major culprit behind number one cancer in India called the oral buccal cancer, oral cavity cancer, head and neck cancers. So tobacco causes all the cancers from head to foot, mainly the oral cancers, lung cancers, a lot of cancers from due to the carcinogens from the tobacco leaf. And the other system involvement, mainly the heart attack, cardiovascular system, heart attack, hypertension. And brain, we have stroke and other major problem. And we have lung diseases, mainly COPD, pneumonias. Pneumonias are very common in smoking individuals. And children, they have otitis media and other thing. In the reproductive system, infertility is one of the major reason. And the gastrointestinal system, we can see a lot of gastritis, acid disease, gastric cancer, etc. So head to foot, the smoking causes all the problem. So how to avoid smoking? Because smoking hazards, tobacco smoking hazards are a lot. So cancer, heart attack, COPD, reproductive problem, and a lot of issues from the smoking. So we have to stop smoking from young individuals, from the school level, from the college level. We have to create awareness about the smoking hazards. Then only we can prevent. If patients already smoking for more than 10-20 years, so how to stop smoking? This is very important. We have a tobacco cessation clinic. So in the tobacco cessation clinic, we do the proper counseling and we give the treatment modalities like psychotherapy and medical therapy using the nicotine replacement treatment in the form of nicotine gum, nicotine patch, nicotine inhalers and all. And we have a tablet form also available to treat tobacco cessation program. So we give the tablet bupropion, this is antidepressant medications, As per the recommendations, we will take 2 to 3 months, and we have a vernicillin tartrate tablet morning night we have to continue for 2 to 3 months as per the instructions of the physicians. So this way we can avoid, we can cut down the smoking, we can stop completely, we can cessate, we can do the tobacco cessation. So tobacco causes all the problems from head to foot. So active smoking, passive smoking, third smoking, all very bad. Vaping, that is electronic smoking, also very bad. It causes all the problems from head to foot. Needs a proper awareness from the school level and college level. So we have to educate the patient and teach them. Each and every visit we have to ask the patients whether you have any smoking history, how many cigarettes per day, we have to ask thoroughly. So smoking individuals, more than 20 years smoking individuals, so we will take a low dose CT scan to see whether any early lung cancer. Because majority of the lung cancer, 1/3 of lung cancer presents silently in individuals like tobacco smoking individuals. So tobacco causes a lot of problem, needs a proper awareness. That's why the World No Tobacco Day every year, May 31st, as per the WHO recommendations. So any queries you can ask me through our link we have subscribed here. So thank you. Namaste.